Hello, I'm Dr. George Everly. The topic I'd like to speak about today is the strategic response to the viral pandemic from a human resilience point of view. The most widely used strategic planning system in the world for disaster mental health is Critical Incident Stress Management, or CISM for short. CISM is a strategic planning formula. It's not a tactic per se, but it's a way of organizing and integrating a multi-pronged approach to fostering human resilience. We utilize a continuum of care in the CISM process, and there are really 3 points to that continuum. One would be fostering wellness before something untoward happens, in this case the outbreak of the virus. Secondly, resilience fostering interventions such as one-on-one crisis intervention, psychological debriefing, diffusings, crisis management briefings. And lastly, the third point on the continuum would be treatment and rehabilitation. And those are things that typically are handled by licensed mental health clinicians. In terms of fostering the CISM response, developing it, it really should consist of 2 aspects. The first would be behaviors designed to foster an organizational culture of resilience. Secondly, how do we foster personal resilience within other people? Fostering an organizational culture of resilience can be achieved, we believe, through practicing resilient leadership principles. Resilient leadership principles were empirically derived from a number of leadership studies, especially under crisis. And they involve things like optimistic leadership, having a plan, being decisive. But more of the focus for critical incident stress management is on how do we support individuals and small functional work groups. That's what CISM really specializes in, is rebound, fostering the bouncing back. From an organized standpoint, peer support teams are what's most usually embraced, especially in emergency services and healthcare. This has also been used in the military. But members of peer support teams should be adequately trained in critical incident stress management, psychological first aid, psychological crisis intervention, whatever terms you'd like to use. Typically, that training consists of 2 to 4 days as an absolute minimum. It is not therapy. It is not a substitute for therapy. Again, referring back to our 3-point continuum, we have the wellness, resistance fostering, immunity building activities before the event. We have the treatment rehabilitation at the end of the continuum. And in the middle is where we spend most of our time from CISM, fostering the organizational as well as the personal resilience. To be truly effective, to make sure people don't fall through the cracks, an integrated continuum of care is really required. And that's the purpose of critical incident stress management. I'm Dr. George Everly. Thank you for listening.